everybody. I'm Dr. Adam Mathews, and at Mathews Counseling, we work every single month to provide you with some resources around mental health, behavioral health, and relational health. And this month it is June, so it is Pride Month. So happy Pride, everybody. And we are talking about issues and raising awareness around mental health and the LGBTQIA population. And we have April Bradley, one of our amazing therapy interns, who is getting close to wrapping up your internship, I think, right? You're it's downhill from here on out, right?
This is my last 3 months.
Oh, that's awesome. And she is going to talk a little bit today with us about a more expansive definition of pregnancy and what we think of pregnancy, particularly as it comes to trans and gender expansive individuals. So, April, just talk just a little bit about kind of when we know that the dominant narrative in our society is that it is only women that get pregnant. So talk a little bit, cisgender women who get pregnant. So talk to me a little bit about kind of why we need to challenge that viewpoint as a dominant narrative.
Thanks, Adam. Yeah, pregnancy isn't exclusively a cisgender experience, and it never has been, because
Mm,
not all people who become pregnant are cisgendered women.
mm,
Transgender men, non-binary, and gender expansive individuals, they can and do get pregnant. They've always been a part of the human story, whether or
mm.
not history, medicine, mainstream culture has acknowledged them. So,
Yeah,
Um, it's important to affirm this experience, to support people who need it, to give them
yeah.
the care that they need. And because when you make these assumptions of it, it just creates harm.
Yeah, it will, and it creates a lot of not just emotional harm, but also physical harm because then it keeps them from getting access to care that they really need. And there's a lot of different ways that trans individuals and gender expansive individuals become parents, right? Do you want to talk about that a little bit? Like that, there's also there's lots of different ways that that happens. So maybe talk a little bit about that as well. I think
Sure.
that's important.
Yeah, trans and gender expansive folks become pregnant in myriad ways, through gestation, surrogacy, adoption, stored genetic material, and this can lead to co-parenting, chosen family structures, and but few providers are trained to recognize and to understand what these experiences can look and feel like.
Yeah. And that's where a lot of the harm can come in, right? So can you talk a little bit about like what kind of harm are we talking about? Like what do we know that tends to happen when either medical care providers and mental health providers, when professionals that need access to when they're not aware of these things, when they don't make room for more expansive expressions of gender and sexuality. Like, what's the harm that comes out of that?
Oh, it can be deep and lasting trauma, like medical trauma from misgendering and body shaming, like what you're talking about, birth trauma from the dehumanizing experiences in hospital settings,
Mhm.
emotional distress connected with perinatal mood and anxiety disorders, dysphoria, reproductive grief. It can give rise to isolation, anxiety, shame, dissociation. It can hurt their own relationships, and it can ultimately it
Yeah,
harms their pregnancy.
yeah, yeah. Like it just it's and it that which then harms children, right? Like it can be a generational trauma that starts to happen there. And that access to care um is one thing, right? Like, but it goes beyond access to care, right? The challenges and the obstacles that these individuals have to overcome to be able to access care, right?
Right, structural and pervasive barriers like discriminatory screening processes. Um, I've heard anecdotes of people who've had to go through psychological evaluations even to store their genetic material. Um, lack of insurance coverage, uninformed and unsafe providers, people who aren't affirming.
Yeah.
Um, and it sort of puts the burden on the client and the patient in a medical setting to explain themselves, to teach their providers. And
Um,
that's not their role or responsibility.
Yeah. Yeah, it puts a lot of added pressure and a lot of added responsibility on the individual themselves. And it which that's not there on cisgender folks and heteronormative folks at all. Like it's just not there. And you think about kind of how difficult it is to access care that once you get into see somebody having to go through all of that and really teach them is really, really harmful and difficult. Right. So when we think of like, what's the right word I'm thinking of here? How do we begin to help? How do we kind of push back against this harm that potentially happens and not just access to care, but all of these barriers? How do we begin to help in with our trans and non-binary friends and family?
Um, I think create spaces for all bodies, genders, and family constellations, value them, respect them, and support them.
Mm,
And, I wrote this means co constructing language, checking assumptions, and advocating beyond the therapy room.
mm,
It also means being open to growth and being grounded in empathy,
mm.
using your client's language and co constructing support.
Yeah.
And
Yeah.
again, oh, sorry.
Oh, no, go ahead. Go ahead. Finish what you're
Just
saying.
recognize that pregnancy and parenthood don't look one way.
Yeah, 100%. Yeah. And that means that we are thinking about it and in our education and how we kind of talk about it in our conceptualizations that we are not just trying to fit people into uh to a box and we're considering all genders and all sexualities and in thinking through the idea of pregnancy and family for sure. If for clients that are looking for care, right, who are transgender or who are gender expansive, like what do they need to begin to look for? How do we know that we're not going to have to go into a doctor's office or a therapist office and begin to explain to them or teach them, or that we're going to get the care, the affirming care that we need? What are the things that we need to begin to do to to look for care and to get that care that we need?
Oh, we can look for therapists and medical providers and paraproviders, who explicitly say, we're affirming, we're supportive of the LGBTQ community,
Mm.
um, of transgender and non-binary pregnancy. Look for um, people who center on trauma-informed care and caregivers who validate um, and support advocacy. Um, just off the top of my head, that's what I would,
Yeah,
or I would, that's what I would,
yeah. I think
and
there's
I would
yeah,
call, I would call and ask,
yeah.
especially for medical and mental health providers.
Yeah, I think that when you are looking, the markers that you're trying to look for are all those ones that you said. And there's small things, but there's big things. There's like even just that there's evidence in there in the lobby that they're affirming, right? That you are reaching that their personnel and their staff are asking for pronouns and using the correct pronouns, and that there are things like that they're participating in the community in a way that highlights their involvement, and that doesn't it's not just language that they're putting on a website, but that they are actively involved and demonstrating that in a very real way is partly what keeps those things at the forefront of saying, okay, these are the people that are affirming, that know what they're talking about, that have the education, the resources, and the tools to really make sure that you're getting the care that you need in a way that is not trauma producing, that is affirming, that is moving you in the right direction. So that's really great. April, what's the thing you want people to take away from this conversation? What's the one thing you really want if people to understand?
Pregnancy and parenthood don't look one way. It's
Yeah,
not cisgendered all the time.
yeah. Absolutely. Absolutely. And that needs to stick in our minds, right? That's the idea that it's becoming part of our conceptualization of pregnancy, of family, of parenthood for sure. Awesome. Well, thank you so much for the time. If you want more information about this topic, written an amazing blog that's up on our website. And if you need help to just navigate any of these issues at all, we have amazing therapist interns like April, and we have other amazing therapists as well that are part of the LGBTQIA plus community that have the lived experience to be able to walk you through that. And we'd love to help as well. You can learn more about them at matthewscounseling.net/LGBTQ. And there's videos up of all our therapists there as well. So happy Pride Month, everybody. April, thanks again, and we'll talk to you next time.
Bye.